So basically now moving toward the pathogenesis, which is very important to understand that how it occurs. As we know that epithelium root sheet of heart-wing epithelium that basically um, stimulate the odontoblast, and odontoblast form dentine and etc. Na? As you have studied in your previous years of during your BDS. Now what happened that in the pulp some remnants of the epithelium root sheet of heart wing is trapped in a pulp. Some cells are trapped into the pulp. What happened that then what happened these epithelium root sheet of heart wing, they stimulate the pulp cells pulp they stimulate the mesenchymal stem cells of the pulp to differentiate into the odontoblast. This differentiation is they will form the cores of denticles, means they form the cores of denticles, or you can say form the cores of dental stones. After odontoblast deposit the tubular dentine. So basically, after when the mesenchymal stem cells are differentiated to odontoblast and they form the cores of the denticles, so they will lay the tubular dentine. This will away from the central epithelium and produce a temple-shaped structure surrounding the epithelium, and that is basically what you have denticle, which is a pulp stone. Basically, you can see even this diagram that heart-wing epithelium root sheet is basically trapped. The remnants are trapped into the pulp. They stimulate the mesenchymal cells, form the odontoblast. They form the true denticles, which is present in the coronal region most of the time. So basically what happened after these stones are formed, they are formed during the root development. Okay, means when root is formed, yeah, you can say that before we also have said that these are formed after the tooth. Might the crown are formed, the crown the but not the roots are formed, so they are basically formed during that time. Okay, basically what happened that it occur in the root canal or either the root chamber, which is adjacent to the furcation areas and multi-rooted teeth, like you have molars and premolars either. Okay, because of this, because of the denticle development, typically it will precedes the completion of primary dentine, then it will proceed to the proceed to the completion of primary dentine. Now they have said, of course, we have fully attached and embedded. They are classified on this. Not related to pulp space wall surrounded by soft tissues. So the free is like when it is free. You have the pulp. You have the pulp. It is here. So it is free. Attached when it is actually here. It is actually attached to the pulp, still not fully attached. It is partially present in dentine, but embedded it is actually here will be dentine. So it is basically then within the dentine. Okay, okay. You can see this diagram also. Clinical applications what? Okay, so basically what happened that the pulp stone impinges on nerves due to the pulp pain or not, mild or executed, it depends on. Okay, okay, basically we have okay, histopathology. If you come across the true dentine, it will have of course tubular dentine surrounding a central nest of epithelium. With time the central epithelium degenerates and tubules also undergo sclerosis. Means now linear classification means in the linear manner. Diffuse linear classification do not demonstrate the organization of pulp stone. Matlab laminal means there is no laminal organization of pulp. They show of the fine fibrous irregular classification that often parallel the vascular or collagen, means they are actually parallel to either collagen fibers or blood vessels. They are not irregular or fine fibrous. They show fine fibrous irregular calcification, but basically they are parallel to the blood vessels or collagen fibers. This classification may be present in the pulp chamber or canals. pulp chambers and canals. Okay, the pulp stones were present basically on the apex or more or the coronal region. The frequency it increases with the age, means it is also age related. Basically, we have, like you can see, there's a diffuse linear calcification commonly in radicular pulp demonstrated parallel to the blood vessels. Okay, histopathology, but you have diffuse linear calcification entirely by fine febrile irregular calcification. They are developed in the pulp chambers or canals. This material often is deposited in a linear fission along the course of blood vessels, and means they are like collagen fibers. Okay, you can see a false pulp stone which has concentrated calcification, true pulp stone which has actually dentary tubules and odontoblastic. uh, okay, basically the pulpal calcification you can see either in the dentine dysplasia type 2, pulpal dysplasia, either temporal calcinosis, yeah, Ehlers Danlos syndrome. These are the following things which shows these type of calcification we have.